Greetings, and we invite you into a look at our research on social acceptance of smoking. The purpose of our study is to find out if those who are exposed to smoking find it acceptable to smoke around friends. To help further support our hypothesis, we used information from a study done by McGee that collected data from 1,143 children from the age of 9 to 10. The children completed a questionnaire that assessed their smoking-related behavior, intentions, attitudes, and refusal self-efficacy, as well as parents, siblings, and friends smoking. The findings showed that social factors were associated with how children influenced and how they perceive smoking behavior. A study published in the American Journal of Health Promotion entitled Encoded Exposure to Tobacco Use in Social Media Predicts Subsequent Smoking Behavior sought to assess the potential link between smoking behavior and exposure to mass media depictions of smoking on social networking sites. The study asked an initial surveying whether or not participants had smoked within the past 30 days and how often they had seen tobacco use depicted on TV. Later surveying also asked additional questions on whether or not participants had friends and family that used tobacco and a 4-item validated self-sensation-seeking scale. The results of the study showed that sensation seekers and participants with friends who used tobacco were more likely to smoke. Most importantly, however, the results showed that encoded exposure to tobacco depictions were a significant predictors to the amount of time participants spent smoking, providing support for the hypothesis that encoded exposure to social media depictions of tobacco use predicted later smoking. Studies on our hypothesis, a person with more exposure to smoking is likely to support smoking around friends, do not exist. A study titled The Smoking Habit of a Close Friend or Family Member, How Deep is the Impact? A cross-sectional study, examines the link between school-age kids' uptake in smoking as an adult and the influence of having a family member that smokes or a friend that smokes. In either relationship, the young person is exposed to smoking. While our hypothesis does not study the likelihood of the young person to start smoking, this reviewed study was selected because it highlights exposure to smoking earlier in life. Whether the adolescent or teen chooses to smoke themselves indicates they may or may not support smoking around friends. A male child had a 7% increased chance of taking up smoking in adulthood due to having a friend that smoked. Also significant for females, though slightly weaker, gender, age, marital status, and education level were discovered to have impacts on the participants in the study. In Sage Journal, they studied the attitudes of college students towards the use of tobacco products in their first year of college. It found that social smoking during adolescence has the potential to lead to lifelong addiction. The survey showed that the attitudes increased in positivity from 0.9 at time 1 to 1.2 at time 2. Also, the intentions of them smoking in the future 6 months also increased. The next article uses information from research performed by the tobacco industry that was kept from the general public and regulators. It looked for terms such as social smoker or youth smoker to identify populations that had regular consumption of low levels of tobacco. The research focused more on the idea that smokers were more concerned about others' health risk and less likely to smoke around non-smokers. The article makes reference to the lack of public data that focus solely on social smoking from a consumer standpoint and the characteristics of social smoking. This lack of direct research is a good reason to expand a study similar to ours. The acceptance or rejection of smoking begins in adolescence and is greatly determined by the level of exposure for one's family and peers. There have been many programs started in recent years, such as DARE and Just Say No, to try to lower the number of young people being initiated into smoking. At the present time, the percentage of Americans who smoke is around 20%, which is down from 45% in the 1960s. From the background information we gathered during our literature review, we formed our hypothesis that states those who have had more exposure to smoke tend to support smoking around friends more than those who have had less exposure to smoke. We used the dependent variable of attitudes towards being around friends that smoke and an independent variable of exposure amounts. Data was collected by survey questions about attitudes towards smoking around friends and how many times a week they were exposed to smoking. An example question using the Likert scale is, I believe it is acceptable social behavior to smoke around friends. A, strongly agree, B, agree, C, neutral, D, disagree, or E, strongly disagree. The samples were non-probability convenience samples that included 35 university students enrolled in the BAAS 3020 Foundations of Inquiry and Discovery at the University of North Texas. Participants were enrolled in Section 500 during the spring 2020 semester. The graph in this picture shows the number of people who responded in each category. During our data analysis process, we recoded the data and combined the columns strongly agree and agree to represent attitudes about smoking around friends, and the categories of 0 times per week to represent no exposure, and 1 to 2 times per week, 3 to 5 times per week, 6 to 10 times per week, and 11 or more times per week to represent exposure to smoking. Data was then analyzed using a bivariate table recoded to reflect the percentage difference in agreement between exposure categories. So what are the results and what does this mean? We found that only 21% of our participants who had no exposure to smoking agreed that it was socially acceptable to smoke in front of friends, while 56% of the participants who had exposure 1 or more times a week agreed that it was socially acceptable to smoke in front of friends. That's a 35% difference between no exposure and exposed 1 or more times per week. So we do feel that this supports our hypothesis and represents a large cross-section of various social backgrounds. However, we do recognize that properly defining socioeconomic parameters with further research could provide more clarity of exposure and more triangulation of acceptance from friends. How would a larger sample size with these considerations impact our results? Understanding the limitation to our research could lead to ideas for the future. Future research could include how attitudes change over different generations. Another option would be a longitudinal study to determine how people's attitudes change over their lifetime. A different approach to our study could involve a further look into why they find it socially acceptable to smoke around friends. This study is mentioned in our literature review with a concept that could be expanded and used to understand preventative methods. Finally, studies could be done to investigate the changes in attitude due to social acceptance of alternatives to cigarettes, such as vaping or more recently, marijuana use. In conclusion, using a non-probability convenience sample, we hope to show the correlation between exposure to smoke and how acceptable is it to smoke around friends. With our results showing that 56% of those that agreed had exposure 1 or more times a week versus 21% who agreed who had no exposure, we feel this supports our hypothesis, but understand that there is a bias of sample size and a limited age range. We're hoping that future research could include longevity studies and the correlation of peer acceptance. Thank you.